Welcome to another program of Peace is Possible. My name is Joe Wasserman. Today I'm interviewing Dr. Matthew Blondin and Audrey Blondin regarding the work of Volunteer Optometric Services to Humanity, or VOSH, Connecticut. We will be discussing their work in Nicaragua and their eye care clinic in that country called San Juan del Sur. Tell us about VOSH Connecticut and the work you do with that organization.
Well, VOSH Connecticut is a chapter of VOSH International, which is an international group of eye doctors who provide free eye care services to people in need.
It's like Doctors Without Borders, only it's just for eye doctors.
Right. Almost all of the doctors that participate in this are involved in their own practices, and therefore they can't leave for long periods of time. So we bring people for about a week, whereas Doctors Without Borders, you sign up for a longer stint, like 6 months or a year. So they just can't do that. Most of the doctors that come on our trip with us are from Connecticut. I'm very proud to serve with them, although we have doctors from all over the country who participate in this. We've been doing it for a long time. It's a labor of love.
That's right. And we're the only remaining clinic, any kind of a healthcare clinic still serving in Nicaragua because they've had some changes there over the years. I was looking back while we were getting ready to come on the air, and in 2017, before COVID, there were 58 missions worldwide through VOSH International, and 7 of which were in Nicaragua. And for 2026, there are 13, and 1 is Nicaragua, which is ours. So it's become much more difficult over the years, and then post-COVID, to deal with all the requirements that any of the government may impose. We've been very fortunate that we've had the same sponsor, Dr. Rosalena Bello, since we started. We started originally with VOSH NECO and did 3 missions with them. And Dr. Rosalena has been there from the beginning. So she's able to facilitate all the requirements and the approvals that are needed to be able to, continue with the mission.
Yeah, without approval from the Ministry of Health in Nicaragua, we can't even enter the country. We'd get stopped cold at the border. All our instruments and supplies would be taken,
right, and
there'd just be no mission. So it's great that she has the connections in order to
and is able to do that.
It always goes to like the last day or two before we finally get permission.
So we did,
we actually got a week or two ahead this time.
And we have a wonderful, I always say, I'm active in the State Democratic Party as well. I currently serve as a secretary. And I always say, the team makes a dream, and it's always the we, not the me. And that's definitely how this mission goes. And we've been very fortunate that we've had an office assistant, our Nicole, that's been with us 20 years now, and she is a wonderful facilitator, working with Rosalena and getting all the. This past mission, we had 50 members that came, which I think last year we had 35. So it varies from year to year. And then I think the first day of lunch, she served 137 lunches. So 50 were ours. That means there were 87 local volunteers, and again, some have been there since 1999. And how the structure goes is, if you see those boxes that say donate your eyeglasses, your used eyeglasses, those go to some processing centers around the country. We use a couple of them in Virginia. So around Labor Day, they have like a form, and we'll order different powers. They send them to us. Then we have each member takes one bag, and they transport everything there. I also actually already have bought 2,500 sunglasses, and I'll up that to 5,000, and then we bring 2,000 or 3,000 readers, and then all sorts of. I go to the Lord's Shrine and get the teddy bears and stuffed animals, that kind of thing.
The grandmothers love to take one for their grandchildren.
It was so funny. One of our friends came in and she just dropped off a bag of assorted things, and I took the bag. I didn't realize time, and I packed it. And so we were at the clinic, and we were at the protocol is set up. We go on Friday, we get organized on Saturday, we set it up on Sunday, and we see about 1,000 patients a day, Monday through Thursday. So by the time you get to Thursday, you're getting on your last legs of supplies.
Right, all the good stuff.
So we found this bag that Marie had given us, and in it was all of this costume jewelry. Oh my God. And so we laid it out, and as the patients came in, I got some great pictures of them doing that. So, I always I love to go to Goodwill, and I always say, one man's trash is another man's treasure. And you could certainly, it was great. They were picking out some earrings for the girlfriend or this or that. It was great. So we do that. We try and, there are literally, as much as we give ourselves, what we see in our members, we have an assistant now, John Bedford from Baltimore and or Annapolis, excuse me, and they literally, they come and they leave only with the shirt on their back. They bring whatever clothes they wear during the week, they give them away. And those are the kinds of things that you really, in your world of promoting peace, that's really what it's all about, really. It's great.
Thank you. Tell us about your poster here.
Oh, so the first year when we went, again, it was almost 30 years ago. We were much younger then, with VOSH NECO. So we got to the end, and they said, we should make a chart, of what we did. And they didn't have any supplies there. So they had an old box, and they made this chart. So that became our tradition now.
We cut out one of the boxes that we print.
Here we are, yep. So
use it to keep track of how many people we've seen each day and what the total is. Mm-hmm. Not too fancy, but it
it's
works.
fun, yeah.
So I think we should keep that up. So we saw a lot of folks, over 4,000 people, which was a record for the particular clinic we're in.
Yeah, because we had to move our clinic site a few years ago. After COVID, we had to move it, right.
Yeah, the government wouldn't allow us to use a public school anymore, so we moved it to a private school. And basically, we take over the entire school for that week. Luckily, January is their winter vacation. So
yeah, so it works out perfect, right?
It's summer vacation for them. But so we take over the whole school. There'll be 4 or 5 eye exams going on in each classroom, so that we've got a whole bunch of people getting examined at the same time. That's how we're able to do these kind of numbers. It was pretty amazing Monday morning.
Yeah.
I had warned everyone, especially the people.
The first day is always the busiest, yeah.
When you come, don't freak out.
Yeah.
Because we came and the entire courtyard of the school was just jammed with people.
It was amazing.
Everywhere. So it was almost scary to think that many people showed up and wanted something.
Right.
But we worked through the day, and we have student doctors who might not be that experienced, but by lunchtime they were pretty together. So it all worked out. We managed to see over 1,200 people that day, and you have to realize that people there, they really have nothing, So their chance at seeing an eye doctor is basically zero. So that we are probably the only eye doctors they're going to meet in their lives. So you have the chance to really change someone's life with something simple, something like just a pair of glasses, a pair of reading glasses. I always like to talk about the United Nations. United Nations has a term for that. It's called functional blindness, where if you don't have access to eye care and you have you have refractive problems, you just can't see. It's essentially you're blind. So these folks, they have nothing. They'd like to be able to read. People are very religious there. They want to read the Bible or whatever. If you're actually, it starts earlier there. If you're in your 30s there, you start having trouble reading. Whereas here in the United States, it's usually 40s.
Or your 40s, right.
But nutritionally, those guys are deprived, so they hit this stuff early. So if you're in your 30s and you don't have a pair of reading glasses, you're done. That's it. It's over. You're not reading that anymore. Especially like Bibles have like really small print too. So we're handing out reading glasses right, left, and center, and it's like you watch their faces. You just turn the lights back on for these people. So the effect that you can have in changing someone's life is much greater there than it is here. I try to emphasize that to the doctors and student doctors, so they'll understand that, here in the United States, eye doctors are trying to enhance vision. There, you're restoring sight. It's a different level of care that you can bring to these people. And it's just a joy. We love doing it. I'm lucky that I'm married to the most organized person on the planet who can pull this off, who can pull together the money,
It's
who
not
can
just
pull together
me,
the supply.
it's everyone.
Well,
It's a
you're a
group.
big part
It's a
of it,
group
though you're
effort.
very nice to say that.
No.
And you have to realize we can't ship anything there. If you ship stuff there,
Yeah, it won't make it
stopped
through
at the
customs,
border
right.
and you don't see it again. We tried that one year when UPS said, "Oh yeah, we can ship to Nicaragua, no problem." We sent a whole bunch of boxes. They made it as far as the border, and then stopped. And we did manage to get them back. Luckily, I had a buddy who was running a hotel there we were staying at. He went to his bank account, took out $1,000, went to the bank of the customs official in charge, deposited $1,000 in his account, and brought him the deposit ticket 2 days before we were going.
Wow.
And suddenly our stuff was available again. It was amazing. So I learned my lesson the hard way on a lot of these things. We don't. Everybody brings one bag of their stuff and one duffel bag of our stuff.
Which we have to pack,
So
we ship
we're
it,
accumulating all
we
this
do
junk
all
in my
that.
office.
Right.
And then
Thank
a lot
God
of you and your
yeah.
helpers are packing stuff in boxes and shipping it across the country to all these people all over the place. And then they take it out. They have to repack it into a duffel bag that's in the box because the airplane guys won't.
No, they don't take boxes. They only take duffel
bags
bags.
or
Right.
suitcases, and then go down there and
Yeah, and we have a great transport person that's been with us from the beginning, Richard from Gabby Transport. So he arranges that. And then the clinic has evolved from being it's a small, San Juan del Sur is a small town. It's supposed to be, it's between 2.5 and 4 hours from Managua, depending on the traffic.
Yeah.
And
quality.
and so it's off the Pan American Highway on the Pacific Coast. So VOSH NECO originally started this mission about 10 years after the war ended, and Newton, Massachusetts was the sister city of San Juan del Sur. So they went down there, they met Rosalina, and they said, "Oh, this would be good, let's do a VOSH clinic here." So at that time, pretty much anybody could do anything, totally different today. And so they got it set up. They sent out, you didn't have the internet then, so they sent out a letter. That's how we ended up joining them. But for the first, I would say 15 years or so, the clinic was mostly just the people in San Juan del Sur. So if you look at the totals of the patients over the years, it was less. It was a lesser amount than what we have now. And then what happened was, actually, when I was running for Secretary of the State, like more than 20 years ago, and I went to, which was the town down in, Norwalk. I think it was Norwalk. Norwalk was the sister city of Nagarote. So I met some of the sponsors there, and they said, "Oh, could you see our patients?" So they would sponsor a bus, and they would come to the clinic, and that evolved into, well, if this works, why don't we see if we could get some other buses from the surrounding area? So what has happened now is, because after COVID, we had to move the clinic site from being in the town out a little distance down the road. All the patients are brought in by bus. So we have about 10 buses a day, which are supposed to have 60 people, but have more like 100 people. What happens to the old school buses from America? They end up in Nicaragua.
Yeah, probably chickens on board and all sorts of crazy.
So they come. But it has dramatically increased the cost of the mission. I think when we started, 25 years ago, maybe it was $5,000. Now it's more than $25,000 to run this mission for 1 year. The buses are $10,000. The lunch this year was $3,200. The shipping is another $2,000 or $3,000. The supplies are $5,000. It's a big operation at this point. We charge a small mission fee, a couple $100 for the mission members, but that's only kind of a drop in the bucket. The generosity is through the Connecticut Association of Optometrists.
And other people who are friends.
They donate. And thank God now for the GoFundMe. And most of the volunteers do a GoFundMe page. We link them all together, and I had a couple. And again, I do all the fundraising. I send all the thank you notes, and we've had a few $1,000 donations this past cycle. Patients go to their doctors, like we have a doctor in New Jersey, and they say, "Oh, we really like what you do. How can we help?" And we had our 50th wedding anniversary in May, and so we don't want any presents or gifts or anything like that. So we had to instead of doing that, make a donation to VOSH. So we raised almost $5,000 for VOSH for our 50th wedding anniversary. So, if I have somebody and they, I do something for them and they say, "Oh, can I pay you?" And I say, "No, you can make a donation to VOSH." So that's been helpful, but it is kind of, it's a struggle, kind of a grind.
Every year it costs more too.
You've got it. You've got to keep at that.
Thankful to some of the Lions clubs in Connecticut have been very generous.
The Lions Club has been generous. Litchfield Lions Club has been wonderful. And if anybody has, some people are like, "Well, I have all these used eyeglasses," or people pass away. They're like, "Well, what do we bring them to our office?" We send them off.
Yeah, we ship them
and
down
we
there.
send them down to the recycling center. They redo
They
them.
clean them.
Yeah.
And they sort them by power, and they put all similar powers in these little boxes labeled, and then the little boxes go in a big box, and they ship them to us, and we bring those along.
Right.
So that like when we open the dispensary where the glasses are, they simply open it up, take out the little boxes, and stack them in order by power, and you can have a whole dispensary ready to go in a half an hour.
Oh, yeah. Well,
It's
but
amazing.
we have the same opticians.
Yeah, we
for almost 20
have
years,
some
same
wonderful
thing.
opticians who
Right.
come along on these missions, and they're just great people, and they work their hearts out.
And I think that's part of the interesting dynamics of the mission is, again, we've been doing this almost 30 years now. So our children all go once. I think our daughter was the first to go, and she was 10, I think, when Rose went. Now she's 36, and our sons all came, and and now we have people that bring their children. We had one of the. Well, I think what it was, one of the nurses brought her her two sons. Dr. Mongrome brought his son. So so you see the different generations there, and we're almost on the second cycle of healthcare providers, because we're getting so old now, and a lot of the original doctors have kind of aged out, but we have a wonderful younger group of doctors now.
It's a great group
that are
there
coming,
can be all sorts of, when you have a group of doctors who are there, they're all kings and queens in their little fiefdom, and it can be hard to get them to do the, follow orders they're used to giving them, not taking them. Awesome. They were great folks.
Really
Everybody
good.
got along. No crazy politics or funny business. It was super.
It was pretty good, and we had we didn't see this, but a couple of the local Sandinistas came in, I guess, in full.
Yeah, army stuff with machine guns.
Yeah, and we were like,
we thought like, what's going on? Apparently, they just wanted their eyes checked.
They got their eyes checked. That was good, and we're there. We have some of the police officers came, and I mean, we felt relatively safe there, but we don't, back in the day, it's a level 3 travel alert. The one year we didn't go in 2019 was a level 4 travel alert. So level 4, forget it.
Can't get anybody
it dropped down to level 3. This is a State Department level that they do. But again, 15 years ago, back in the day, it was a level 2 travel alert. And so there was a lot of tourism. There was a lot of you could travel around.
See the place starting to come alive,
Right.
With people who wanted to, from outside who wanted to come in, and people bought homes. There were some fancy homes built on the coast there. But
And wasn't the
now
UConn
it kind of emptied up.
UConn basketball?
Yeah, Travis Knight built a home
Right.
on one of the cliffs overlooking the bay, and beautiful place.
So we're more with everyone gets their badge, and we're more like you're with the group. We try, it's again like herding cats, to get everybody there, at the same time, arrive in Managua, 2 p.m. on Friday, get on the bus, go there, and then, so we went to the volcano. I must say, I'm sorry about Hawaii. We did go to Hawaii last year, too. The Nicaragua Volcano National Park was
cool.
Spectacular.
Yeah, really good.
Spectacular. Okay. It was awesome. So we did that, we'll do a little tour thing. But mostly we stayed at the clinic.
Yeah, I'm the only guy in this mission. I rented a car.
Right,
we
rented a car.
Because we have to run around and buy supplies and other stuff, and it's just easier to have a car. But I don't really go out of town.
No.
Because there are checkpoints on the road, and you're an American, and I don't know, anything could happen.
And we stayed in a wonderful place, the Hotel
great
Victoria.
hotel.
Wonderful
I
service.
love
They
the
take
staff
such
there.
good care of
They all
us.
know us. It's like
Wonderful. Right on the beach.
The town itself, San Juan del Sur, is a small city.
Small little tourist
kind of
town,
like
really.
Torrington in a way. And we've been going there so long. We know a lot of people there.
Yeah.
So it's kind of like old home week when we show up.
yeah.
It's nice to know people, and that's important when you're trying to run a mission. You need to have people on the ground who support you.
Right. We're
And
very
know that you're
blessed,
bringing people
right.
to a safe place, because you don't want to risk people's health or welfare.
No.
In bringing them. They trust you, so.
There are a lot
I
of
feel like-
scorpions.
I
a
feel
lot
like
of snakes,
everybody's
right?
dad while I'm there. I got to keep them safe and get them over one piece.
So we watch out for the scorpions.
There are
A lot of
scorpions there.
scorpions,
I've
lot
got
of
several
snakes.
stories over the
Yeah.
years about scorpions, I can
Yeah,
tell you.
people that-
But nobody got bit, nothing,
we
no
didn't have
health
this
problems
year.
this time.
Thank God.
I did,
so.
it was 2 years ago, I got bitten by a spider.
Yeah, he got
on
some
the-
cellulitis in his
I
leg.
learned not to wear shorts on the bus coming from the airport.
Okay.
It was kind of like rickety old bus, and it was nighttime, it was dark, and I had shorts on because it was hot. And I got bit by something. I assumed it was a spider on the bus, and I ended up developing cellulitis in my lower leg. And
Oh, scary. Yeah.
yeah, it was a little sketchy. The local doctor said I should go to the Nicaraguan hospital.
We don't think so.
I don't think so. Let's go over there. But she did give me some antibiotics, and they did sort of work.
Yeah. You survived.
I
so we
survived.
know.
I was, I was staying at my post, and
Yeah.
you lead by example. I gotta do my job. So, and we made it through, and all worked out fine.
So we really, again, we want to thank everyone, certainly here in Connecticut that has been so supportive of the mission and of the, helping us to help the people in Nicaragua. And again, we're very grateful to all of the local people in Nicaragua for allowing us to continue to serve. And we're just
It's a joy.
on to next year.
Yeah, we got back, and we're already thinking,
get ready for the next,
can
right?
we pull this off again?
Right.
Because we'll just keep going as long as we can.
So thank you for having
It
us.
was
We
great
really
to be here.
appreciate it. Thank you very
taking the time
much.
to talk to us. In my discussion with you ahead of time, I say you talk about things on a big level. We're in the trenches.
Okay.
And it reminds me of public health or master's degree. People in public health, they're like in the clouds looking down at everybody in groups. Whereas we're, as an optom, I'm in the trenches. I'm down there one-on-one with people, and so are you. And it's a delight. I don't know how to express it, but we met so many wonderful people, so many little kids, and these little kids, they get all dressed up to come to the clinic, and probably the best outfit they
Yeah,
get.
it's great.
They are just cute as buttons. It's unbelievable.
So
And turning the lights back on is a lot of fun.
it is.
I just
great.
love it. And I don't have to worry about money.
Yes.
There's no money
No
involved.
insurance, right?
There's no insurance forms.
Right.
I'm not on the computer filling out charts later on in the middle of the night for people I saw that day. You just do it because you love doing it.
Right.
Because you have, I'm very grateful to the doctors who do this with me. That I get all choked up. That they use their knowledge and skill in a way that has no benefit to them. That they go out there, they're working their hearts out because they love helping.
How does this change? How does this change the doctors? How does this change you? The experience changes. How does it change you?
I think I just love helping people. It's a joy, and we have, thankfully, because of her, I had the ability to do it.
Wow.
To get this thing to go. So it's a group effort. I think we're kind of unique. We make a good team. That this would be any doc running it by himself. There's no way you have time or to be able to pull this off. Whereas as a team, we're able to somehow do it.
Well, and I think you really don't sweat the small stuff, and there are always times as we go along where somebody's very upset about something, and you're just like, what, you just have to have a different perspective of what it would be like to live in those things you see on TV, the shack on the hill, no electricity, no running water, you're struggling for food, you don't have a pair of shoes. We're very, very blessed here. No matter what goes on in our day-to-day lives, what we have compared to those in need it really does. It's really a life-changing event. So
how can people get involved with VOSH, either through contributing their time or money?
So you can go on, if you just Google VOSH, VOSH-CT, a whole stream of information will come up. And also on VOSH.org. And we're at 379 Prospect Street in Torrington. Anybody can make a donation to VOSH Connecticut. And we
are
we're
registered as a
fully for
charitable
years
organization,
now.
so
Again,
deductions,
almost
you
25
can
years
deduct
now.
whatever you contribute.
Everything is completely tax deductible. And then anybody that's interested in joining the clinic,
We don't take civilians.
yeah, we go on, just look on VOSH.org and the information. I haven't posted it yet for next year, but pretty soon I'll post it up, and they'll have the 2027 mission, and we have forms they have to fill out and all this kind of stuff, and they get their
Bingo.
hotel, they get their plane flight. The airfare is about $600
Yeah,
round
people
trip.
pay their own way.
Right.
Wash,
Hotels,
the only
another
thing we
600.
provide,
Right.
we provide the clinic site, we provide
Food.
breakfast and lunch the 4 days of clinic. We have our setup day on Sunday, we
To
provide.
get pizza.
We
Yep.
buy 30 pizzas we
Yeah,
bought.
yep, yep.
But when we went into this little pizza shop and told the guy we wanted 30
Yep.
pizzas by tomorrow.
And they're like, oh, okay.
Oh my
Yep.
God, this is like the sale of the century.
Yep,
So when we talked before, you mentioned the doctors keep coming back,
yes,
and the staff keeps coming
Yes.
Yeah.
back, which is interesting.
Well, I think it's addictive. It's just such a heartwarming thing to do. And I think a lot of these people feel the same way that I do, that I think healthcare should be about people, not about money.
right.
And they're willing to give their time and expertise and effort to make this happen.
And I think we're very respectful of or we try anyway, to be very respectful of the different members of the team. So like the optical, again, it certainly helps to have the same people come year after year, but kind of they do their thing. The doctors do their thing. The translators do their thing. The helpers, everybody knows now, like we had a new helper in our room, and he assisted with, with getting the slips. They have, each patient has an exam slip, so they have to go and collect them 2 or 3 times a day, count them, and get the count. So everybody kind of finds their niche. Certainly, we're always in need of translators. Anybody that's somewhat fluent in Spanish that wants to do some
great.
Spanish immersion. It's a great
Yeah,
place
big time.
to come and do that. Or we had 6 or 7 pre-optometry students.
These are college kids.
College students that are interested in going to medical school, going to optometry school. It's a great, it looks great
Looks
on your
great on your resume,
application
Looks really
to
good.
do that. So they come, they assist the doctors. You had that in your room.
Yeah.
It was great.
Thank you for joining us today and for your work in behalf of the people of Nicaragua
Thank you for having us.
and for those in need in places that you serve.
Thank you.
Thank you.